Welcome. In this video, we'll be diving into a common yet potentially sight-threatening eye condition called macular edema. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Understanding macular edema is crucial for preserving your vision and ensuring optimal eye health. Macular edema occurs when fluid and protein accumulate in the macula, the central part of the retina responsible for sharp, detailed vision. Several factors can trigger this fluid leakage. The most common cause is diabetic retinopathy, a complication of diabetes that damages blood vessels in the retina. Other potential causes include age, related macular degeneration, retinal vein occlusions, uveitis, which is inflammation of the eye, and even complications following eye surgery. In some instances, certain medications can also contribute to the development of macular edema. Identifying the underlying cause is paramount for effective treatment. To understand macular edema, we need to delve into the mechanics of the eye. The macula, packed with photoreceptor cells, is responsible for central vision, allowing us to see fine details and colors. Healthy retinal blood vessels maintain a tight barrier, preventing fluid from leaking into the surrounding tissue. When these vessels become damaged or inflamed, they become leaky. Fluid, including proteins and lipids, seeps into the macula. This excess fluid disrupts the normal structure and function of the macular cells, leading to swelling and blurred vision. The swelling interferes with the photoreceptor's ability to transmit clear signals to the brain, impairing central vision. Macular edema is a relatively common condition, especially among individuals with diabetes. The prevalence of diabetic macular edema increases with the duration and severity of diabetes. Age-related macular degeneration is another major contributor, making macular edema more common in older adults. Retinal vein occlusions also significantly contribute to its prevalence. While specific numbers vary depending on the study and population, macular edema represents a significant cause of vision loss worldwide, highlighting the importance of early detection and management. The symptoms of macular edema can vary depending on the severity and cause. Common symptoms include blurred or distorted central vision. Straight lines may appear wavy or bent. Colors might appear faded or washed out. You may also experience difficulty reading or performing tasks that require fine detail. In some cases, there might be a small blind spot in the central field of vision. It's crucial to note that symptoms can develop gradually or suddenly, so any noticeable changes in vision should be promptly evaluated by an eye care professional. Diagnosing macular edema typically involves a comprehensive eye examination. Your ophthalmologist will likely dilate your pupils to get a clear view of the retina. Optical coherence tomography, or OCT, is a non-invasive imaging technique that provides detailed cross-sectional images of the retina, allowing for precise measurement of macular thickness and fluid accumulation. Fluorescein angiography, another imaging technique, involves injecting a dye into the bloodstream and taking pictures of the retinal blood vessels to identify areas of leakage. These diagnostic tools help confirm the diagnosis and determine the extent of the macular edema. Macular edema can be classified based on its underlying cause, such as diabetic macular edema, cystoid macular edema, or macular edema secondary to retinal vein occlusion. Diabetic macular edema, further divided into categories like focal or diffuse based on the pattern of retinal thickening. Cystoid macular edema is characterized by cyst-like spaces within the macula filled with fluid. The specific classification can influence the choice of treatment and management strategies. The primary goal of treatment is to reduce fluid accumulation in the macula and improve vision. Treatment options depend on the underlying cause and severity of the condition. For diabetic macular edema, managing blood sugar, blood pressure, and cholesterol levels is crucial. Anti-VEGF injections such as Avastin, Lucentis, or Eylea are commonly used to block the growth of abnormal blood vessels and reduce leakage. Corticosteroid injections or implants can also help reduce inflammation. Laser photocoagulation, a procedure using a laser to seal leaking blood vessels, may be considered in certain cases. Vitrectomy surgery, which involves removing the vitreous gel from the eye, may be necessary in more severe cases or when other treatments are ineffective. Careful monitoring and adherence to the treatment plan are essential for successful management. While macular edema cannot always be prevented, particularly in cases secondary to genetic predisposition, certain measures can reduce the risk. For individuals with diabetes, maintaining strict blood sugar control is paramount. Regular eye exams are essential for early detection and prompt treatment. Managing blood pressure and cholesterol levels can also help reduce the risk of retinal vascular damage. Protecting your eyes from ultraviolet radiation by wearing sunglasses can contribute to overall eye health. The prognosis for macular edema varies depending on the underlying cause, severity, and response to treatment. Early diagnosis and prompt treatment can significantly improve visual outcomes. However, untreated macular edema can lead to irreversible vision loss. Recent advances in treatment, such as new anti-VEGF agents and sustained-release corticosteroid implants, have shown promising results in improving visual acuity and reducing the need for frequent injections. Research continues to explore novel therapeutic strategies and preventative measures to combat macular edema and preserve vision for those at risk.